It's very tragic because we are dealing about individuals in their primes, from their 20s to early 40s. And yes, we are quite confident that these are drug-related deaths based on first investigation, the scene investigation, which in these cases are typical drug scenes with multiple paraphernalia found next to the bodies. Even some of these bodies were found next to naloxone kits. And we did perform the autopsy, which we always do in the cases like this to rule out any underlying conditions which may contribute to that. When we're talking about very young individuals, I don't think that they've been using drugs for years. I think this is something that comes with the culture, something comes sometimes with the peer pressure, something comes with the experimentation, and just they're mostly hearing about feeling good and feeling high, but they're not hearing the stories as we are presenting it now. That these stories, they should be scared of starting the drugs now, especially the drugs that you cannot trust because they are coming from the market that you cannot trust. So it is, you just don't need much. That's why we are avoiding the word overdose, because overdose is adopted in the public and they know what does that mean. But for the forensic pathologists, you don't need to overdose. Even the small dose can be lethal.
Right. Overdose suggests that you've taken too much of something.
That's right. But you don't have to take too much. You can just mix it even sometimes within the therapeutic levels. If you're mixing the drugs that shouldn't be mixed, you can die off.
Last time you and I talked, we were talking about the number of deaths that had been recorded. And I know you don't have the numbers for last year in totality because you're still waiting for results to come back. But can you give us a sense of where we're headed in terms of, are you seeing any trends? Are numbers going up? What's your sense of where things are going?
The numbers are going up. In 2022, so 2 years ago, we had 37 cases of accidental drug toxicity related deaths. 2023, which is the year which is still open with us, because again our results are some lagging behind. We have 57, and it's going to change probably. We're going to see a few more cases. So we are doubling up. Where all of this is, we are doubling up with the number of cocaine-related deaths. As I said before, it's a primary drug in this province. In January, based on my search of our database, we only had 2 cases, really, of which one was a fentanyl-related death, and these 2 cases are outside Metro. So just in February, we were dealing with 9 cases. So we have a group of 5 cases that came in, but we have a previous group of 4 cases, of which 3 were outside the metro area, and 6 cases within the metro area. But we should be working on a younger population, the people who are just starting up using illicit drugs or thinking of. We have to really tell them the true story to scare them off, because again, with the small quantity of the drugs now in the system, they can be detrimental and lethal. The people who are taking the drugs for the period of time, they already have as I said, certain mental burdens, but they're also having issues with their general health, heart disease. Like with the cocaine, we know people who don't have a cocaine in their blood at the time when they die after the period of using the cocaine for years, their heart looks like in somebody who is 80 years of age with coronary artery disease, blockages, enlarged heart, scarring of the heart. So there's always a risk. And I start thinking this as almost as Russian roulette. You know, you're putting the bullet in the chamber and you're trying to just wait whether you're going to be lucky. But the luck eventually is going to run out.